not everyone recognizes it. And recognize has at least two meanings. It could mean to recognize it existing at all, or it could mean to recognize it in a given case, right? So the problem is you've got both of those issues. For the people who don't recognize that it exists, I think it's so clear that it does exist that that's not a legitimate position. All the word means, alienation or parental alienation, is that a child, that a child has resisted contact with a parent or rejected a parent for no legitimate reason, and usually the definition includes as a result of undue influence. So when you say you don't believe in parental alienation, you're saying the equivalent of I don't believe that any parent ever undermines the other parent with a child. In terms of recognizing it in a given family or child, here again I want to clarify the terms. The parental alienation can mean a bunch of things. It could be a family dynamic, which involves at least 3 people. It could be the behavior of a parent, an alienating parent, or it could be the result of that behavior in a child, an alienated child. So anyone who's looking to identify it needs to look at the big picture and to consider all 3 corners of a triangle: parent, parent, child. Professionals is mental health, legal professionals, and other professionals, including judges and people who make important decisions. For one thing, it requires certain types of thinking that are not commonly taught to professionals. Some advanced medical concepts, for example, reasoning backwards from effect to cause, and conditional probability, which is the probability of one thing given another thing, or the probability of one event given that another event has already occurred. So not to get too technical, that's the first point. It requires special expertise, and that expertise is not necessarily common among the people who deal with these cases. The field itself and the phenomenon is very counterintuitive. It may or may not run counter to professional intuition, but there the professional intuition has to be at a specialist level. So I wouldn't say it's counterintuitive for someone who is a specialist in this area, just like quantum physics. If you're a professor of physics, it's not counterintuitive to you. If you're a normal person, it is. Most people, when I point that out, they think I'm warning them to be careful. And I'm sort of doing that, but I'm actually doing much more than that. If something's counterintuitive, the main point is not to be careful. The main point is not to use intuition, again, unless it's professional specialty level intuition. So that makes most people skeptical. I think many judges, when they hear that it's counterintuitive, either they think that that's implausible, or they think they're an exception to the rule. Their intuition will get it right. One thing that's counterintuitive is what I just said. It requires specialty level expertise. The average lawyer and the average psychologist don't believe that right from the start, especially if they're senior people who have been doing it a long time. That's not one of the better examples, but it lays a little foundation. Another example is that it's very difficult to get a child to reject a parent. Children are instinctual creatures, and to reject a parent is counter-instinctual. If something's counter-instinctual, children won't do it unless they're being induced to do it, or manipulated to do it, or encouraged to do it by someone. So when you see a child who's rejecting one parent, especially strongly, and you see a child, the same child, is strongly aligned with the other parent, probably that's an alienated child, not an estranged one. This is evidence-based science. You don't just get to make it up. I think it's important, as an aside, to distinguish between science and a belief system, or science and ideology, or science and speculation. Not only is it counter-instinctual for the child to reject a parent, but children don't even reject abusive parents or physically abusive parents. People know the famous Stockholm Syndrome, where in 1973, 2 bank robbers took 4 people hostage for 6 days. And At the end of that time, the prisoners, the hostages, resisted rescue, criticized the rescuers for rescuing them, and refused to testify. So the point is that they identified with their abusive captors so strongly in only 6 days. What does that tell us? It tells us that people will identify with the abusive person. It seems to be some type of a coping mechanism or survival strategy. But that's for adults in only 6 days. Imagine if it's a small child or an adolescent with your own parent. Non-specialists tend to mistake something called pathological enmeshment with healthy bonding. And they will do that almost every time if they don't specialize in alienation, estrangement, enmeshment, and in particular how to tell them all apart. So to define that term, pathological enmeshment is in this context is a family dynamic in which the parent has essentially engulfed the child. I like to throw in mind, body, and soul for emphasis. Other words people use are hijacked the child, co-opted the child. The net result is that the parent has obliterated the normal, healthy, interpersonal boundaries that should exist between a parent and a child. Obliterated or erased those boundaries. The child loses his or her identity, sense of self, individuality, independence, autonomy, critical reasoning skills, and other important characteristics. This is very, very bad for a child. It's even worse if you realize that the primary problem is a very severe boundary violation, so the child grows up not understanding normal boundaries, which is a huge problem in itself. And then when you look at the parents, they tend to have a great deal of psychopathology. For a start, they're almost always pathologically dependent. They're using the child to meet their own needs. They are exploiting the child and corrupting the child. They're often using the child as a proxy to do their bidding and to further their goals and objectives. This is a terrible thing. But when non-specialists see it, what you see is a child who seems close to mom or close to dad. They can sit in an interview and the parent is rubbing the child's back and holding hands, and the child tells you how great the parent is and how bad the other parent is. Anyone who doesn't have specialty level expertise is liable to leave that interview thinking, what a great relationship. So I'll repeat the phrase, non-specialists almost always, and I don't use a term like that lightly, almost always mistake pathological enmeshment for healthy bonding. So another example of something that's very counterintuitive is that the alienating parents tend to present very well, and the alienated parents or targeted parents tend to present not well or poorly. And there's a specific reason for that. What's going on here is the alienating parent tends to be a master manipulator, often an accomplished liar, brilliant at managing impressions, and so on, and is the aggressor who's winning. The other parent is a trauma victim. So the alienator presents with the 4 C's. He or she is cool, calm, convincing, and cool, calm, charming, and convincing. By contrast, the alienated parent, the targeted parent, has the 4 A's. He or she is anxious, agitated, angry, or afraid. And if you don't know to look for that pattern, and you interview each one, you think you've got it all figured out after the first interview with each person. If you do recognize that pattern, then you know it may be the other way around. So I'll slip in the phrase pattern recognition. Pattern recognition turns out to be a big deal in these cases. If the professional doesn't have specialty level pattern recognition, or better yet, subspecialty level pattern recognition, you're liable to make a lot of mistakes and miss the important patterns. When you're talking about severe cases, almost always, the almost is important there. And when you're talking about moderate alienation or moderate alienators, then I would say most of the time the parent has some type of a personality disorder. there's significant psychopathology there. Usually when you're dealing with alienation, it's one of three types, or a combination: borderline personality disorder, narcissistic personality disorder, or some type of a sociopathic personality disorder. And they're not mutually exclusive, those personality disorders, so one can have all three or meet criteria for all three. That's another striking finding, but it's also important to keep in mind that those three personality disorders are associated as part of the core pathology with first being charming in most cases, and second being manipulative. But I think there are three things that are not as well known as they should be about parental alienation and the phenomenon. And number one is that it's a form of child abuse. Number two, that it's a clinical problem. And in fact, in many cases, it's a medical problem because of the types of delusional thinking and paranoid ideation and things like that. And the third thing is that it is profoundly counterintuitive. When I say counterintuitive, I think everyone knows that means runs counter to intuition. And I think most people hear that as a warning to be careful. But it's actually much more than that. If something's profoundly counterintuitive, exceedingly counterintuitive, then the message is don't use intuition unless it is specialty level intuition, sophisticated professional intuition, not just professional intuition because I'm a doctor, I'm a lawyer, or someone's a psychologist, and that leads to a lot of errors, because if you're using intuition even when you shouldn't, then you tend to have great confidence in your incorrect conclusions. That's almost true by definition. It feels right. So no matter how wrong you are, if it was intuitive thinking, it feels right, and I'll repeat the catchy phrase, consequently, they tend to have great confidence in their incorrect conclusions, and that's a huge problem. There's a concept in statistics and probability that turns out to be extremely relevant to these clinical cases, and that concept is the concept of a base rate, which I'll define in a minute, and ignoring the base rate, which is called base rate neglect. So a base rate is almost synonymous with the prior odds or the prior probability of something being true before you look at the evidence. If I came to you with a piece of green cheese and told you that this is from the moon, because the moon is made of green cheese, the one reason you would know that's not true is that the probability of it being made of green cheese is 0. And showing me some evidence of green cheese does not change that at all. So, more to the point, there are base rates all over the place in a PA case. Before I know anything about your lawyer, the chances are your lawyer is not a specialist in trying PA cases. Before I know anything about a forensic evaluator, maybe a clinical psychologist or a psychiatrist, I know most people don't specialize in this area, so the base rate for expertise would be low. If we're looking at the court or a judge, what is the probability that the judge has specialty level expertise in this area? Not just a good judge or a sympathetic judge or a smart judge, specialty level expertise, very low. There aren't very many specialists around, even among the mental health professionals. What are the chances that you can win a PA case for a targeted parent or have a good outcome at all with a 2-day trial? Close to 0, because it's so counterintuitive. You don't have enough time to teach the science to the smartest judge around. So the statistical point is very simple. Whenever you're judging a probability of anything, you have to take the prior probability or prior odds and multiply that by the weight of the evidence. The human brain is not wired to do that well, at least not unless you've been taught specifically how to do it. The human brain tends to ignore the base rate and to focus on the evidence. Well, it's a good judge, the judge was taking notes, the judge seemed interested. But if the base rate is very, very low, you have to multiply the two figures. I'm oversimplifying a bit, but that's an accurate statement. And so it's a dangerous cognitive error to ignore the base rates. And it's particularly dangerous in PA cases because there are base rates all over the place. And if you ignore one, you're in trouble. If you ignore all 12 of them or all 20, then you're in even greater trouble.